For more on women's healthcare in China, I'm joined by Kate Tulenko. She is CEO of Corvus Health, a global health workforce services firm. Kate, thanks very much for coming in today. Appreciate it. It's hard to overstate the improvements that have been made in women's and infant mortality healthcare in China. We're talking about literally millions of people lifted out of that cycle over the past 15, 20 years. Let's use a wide brush and talk about some of the reasons.
Okay, so most of the reasons are access to health care, particularly prenatal care. This is the care that a woman gets when she's pregnant to make sure that the baby's growing well, that she has adequate nutrition, and then also you have the time of delivery, that there's a skilled birth attendant, particularly a midwife or an obstetrician, and also that there's proper postpartum care as well.
And when you talk about that access, we also have to look at doctors getting into rural areas and also insurance. It may sound like something very simple, but we're talking about 15 years ago, 83 million women had insurance, and now more than 800 million. What has led to that dramatic change, and how important is that?
So there's both the insurance system and also the free public system as well, and so women can access it through either. So the Chinese government has made changes to make it easier to access the insurance. But if you have insurance, it doesn't necessarily mean you can guarantee that you'll have access to good health care, because sometimes facilities are crowded or they're too far away. Where we see the highest maternal mortality rates and infant mortality rates in China are in the rural counties and in the western part of the country. And these people who live in very isolated communities, so a woman might have to go to a maternity waiting home and wait for several weeks or months to give birth.
And also when you talk about those areas, when you talk about tier 1 cities, Beijing, Shanghai, cutting edge technology, plenty of doctors, access to this kind of healthcare. But when you get out into the areas, you have to think about China's known effort to lift that nation out of poverty by 2020. What has that done, and has it been effective?
Well, poverty has an incredible effect on health, as we know, mainly through nutrition, but also through the housing environment as well. I was looking at some data that looked at the rates of a certain type of birth defect, a neural tube defect, in rural women versus urban women. And this is a good measure of women's nutrition. And the birth defect rate was twice as high in the rural women. So this shows that there still need to be gains to be made in the improvement of their nutrition.
And we were chatting before you sat down also about the fact that women in China, as well as throughout the world, they're having babies later in life. What is that doing? Because that clearly has to be a hurdle to get over, whether it's healthcare or whether it's nutrition or just the stress on the body in general.
So women having babies later in life, they're at risk for maternal diabetes, as well as high blood pressure, and their babies are at risk for prematurity or low birth weight. And so women having babies older can increase both the maternal mortality rate as well as the infant mortality rate.
And it's interesting as well because so many other nations are now looking to China. Other countries are coming to China to see what has been going on there that has been successful, and how can we replicate that in our nation. First, I want to get your thoughts on that. I mean, what a dramatic change, and what are other countries taking away?
Right. Well, I think China's been very strong on implementation. It's one thing to have a very nice, fancy plan and have it all on paper, but there's another to actually carry it out. And that's where China has excelled in actually building the institutions, training the health workers, deploying them, getting the drugs out to the facilities. So learning from that implementation is, I think, what other countries can take away.
And let's talk about that implementation, what it means, because diet is also very important, whether it be milk, from the anemia standpoint, or just fruits and vegetables, and poverty is still a serious issue. I mean, you go to those areas, and an apple is a coveted item, late in the season.
Right. So we're looking at non-medical determinants of health. So looking at nutrition and how that affects health, looking at environment and how that affects health. And certainly that's something that I think China can work on a bit more, make some improvements, improving the quality of the air, improving water quality as well, and environmental health in general.
Do you find that the citizens in China are pushing for, demanding these changes, or is this something being done by the government or by other healthcare entities to make the situation better for the people living there?
I think think it's coming from both sides. I think you have a middle class and an upper class in China that's pushing for a healthier environment, pushing for better health care. I think also the Chinese government realizes that sick workers are not productive and that poor health is actually a drain on the economy. You know, from an infectious disease perspective, the World Bank has calculated how HIV/AIDS and how malaria can really drag down a GDP, and it's the same for ill health in general.
It just makes business sense as well as sense to the folks.
Yeah.
Kate Tulenko, thanks very much. We certainly appreciate you coming in, providing that insight.